In the last year, about 600,000 people were expected to die from cancer. Yet many of these lives could have been saved through earlier detection. Even though screening is key to detecting certain cancers early, when they are most likely to be treated successfully, screening rates have stayed stagnant and even declined for some types of cancer. Now, an awareness campaign is taking aim at that cancer screening statistic. Here to talk about some common screenings that everyone should know about is Dr. Robert Smith, Vice President of Cancer Screening at the American Cancer Society, and breast cancer survivor Debra Stansberry. Dr. Smith, why is cancer screening important?
You know, it's a great question, and it's a message we want to get across. When you don't have any signs or symptoms and we screen you for cancer, we have an opportunity to find cancer that you don't know about. We have an opportunity to find cancer that is still localized, that is, it has not spread to other parts of the body, and that's when it can be most successfully treated, and that's when your chances for survival are the greatest. As you mentioned earlier, there were 600,000, we expect there to be 600,000 deaths in this coming year from cancer. Many of those deaths could be prevented. We could avoid those deaths if people had had their cancer found early through screening.
And what is Cancer Screening Week?
So Cancer Screening Week is an initiative supported by a number of organizations, Genentech, the American Cancer Society, Stand Up to Cancer, and Rally Health, to raise awareness about the multiple screening tests that are recommended to men and women, and to encourage them to become more aware, to talk with their doctors, and to make cancer screening part of their preventive health plan. Your listeners
And when is Cancer Screening Week?
It is right now. It is this first week of December, and your listeners can go to cancerscreenweek.org to learn more information, to get more information about cancer screening tests and this initiative, or they can go to the American Cancer Society's website, cancer.org, to also learn more about screening tests.
Okay, let's slow down and get these web addresses.
All right.
The Cancer Screening Week, is that an address in itself?
It's www.cancerscreenweek, all one word, .org.
Okay. And now let's go to the American Cancer Society and tell us how to find it there.
And that's a shorter web address. That's just cancer.org.
Cancer.org. And if we go to cancer.org, we can find information about Cancer Screening Week.
You can find information about the recommended cancer screening tests. So this is, Dr. Goodwin, we see that sometimes people are current with one screening test, but not others. And this is what Cancer Screening Week is intended to do, is to raise awareness about, depending upon your gender and your age, what screening tests are appropriate for you.
Okay. And Debra, I understand you were diagnosed with breast cancer after your doctor recommended a mammogram. How did this make a difference for you?
Made a huge difference. The fact that we found it early definitely gave me more of a fighting chance. My doctor, like you said, recommended the mammogram. The mammogram picked up that there was a tumor there, and once we did
How old were you at the time?
Actually, I was 35.
Young.
Yes, ma'am. Yes, ma'am. And the mammogram, kind of helped detect the cancer was there. I was diagnosed with stage 1 breast cancer, and it was an aggressive form of breast cancer. And because we found it early, I actually had a fighting chance. Early detection is truly key to survival.
Okay. Okay, and now you're a happy breast cancer survivor?
Yes, ma'am. 9 years.
9 years. That's wonderful. Congratulations.
Thank you so much.
Dr. Smith, what other types of recommended screenings should our Health Power viewers be aware of other than breast cancer?
Most of your listeners who are women are well acquainted with getting regular Pap tests that begin at an early age. At the age of 40, they should decide whether or not they want to begin breast cancer screening. At the age of 50, men and women should begin undergoing colorectal cancer screening. At the age of 50, men should have a conversation with their doctor about prostate cancer screening to determine if it's right for them. And your listeners who are current or former smokers who have a high pack-year history of tobacco use should talk with their doctors about lung cancer screening.
And when you mention the Pap smear, you're referring to screening for cervical cancer.
That's right. And right now our recommendations for cervical cancer screening principally involve the Pap test between the ages of 21 and 30. Women should get that test every 3 years, and after the age of 30, they can either continue getting the Pap test every 3 years or go to a combined Pap and HPV test every 5 years.
Okay. That's the HPV, you say?
Yes, that's the test for human papillomavirus infection.
I see. So if you get the HPV, you don't have to get the Pap, or do you need both?
No, we need both. And we discourage HPV testing before the age of 30 simply because of the high risk of a finding that actually would be expected to regress. But this co-testing is something that we organizations all recommend now.
Okay, that's very good to know. And Debra, what is your message to everyone about the importance of screening?
Well, definitely, one, don't be afraid. Early detection is truly key. Find out what cancer screening is best for you and have that conversation with your doctor.
Okay. Well, let me thank both of you for sharing this information with my Health Power audience. I'm sure it will be helpful. And have a good day, both of you.
Thank you very much.
Thank you.